In this video, you will empower yourself with knowledge about PTSD, a serious and potentially life-threatening medical condition, from top medical resources referenced below as researched by AI. We will break down the condition itself through recovery and hope in 6 essential areas with clear and concise wording. Understanding the condition. Hope begins with understanding, and PTSD represents one of the most treatable mental health conditions today. With 80–90% success rates achieved through modern treatments and breakthrough therapies emerging in 2025, recovery is not just possible, but achievable for most people. Recent FDA-cleared treatments show 88% remission rates with new trauma-focused therapies and innovative brain-based interventions, offering unprecedented hope for lasting healing. PTSD is a complex trauma-related disorder involving dysregulation of the brain's fear response, memory processing, and stress systems. Unlike normal stress reactions, this condition involves persistent re-experiencing of traumatic events, avoidance behaviors, negative changes in thinking and mood, and alterations in arousal and reactivity. Affecting over 70 million people worldwide, PTSD ranks among the most disabling mental health conditions. Yet this prevalence means extensive research has led to highly effective, evidence-based treatments. The condition encompasses several types, including combat-related PTSD, civilian trauma PTSD, complex PTSD from repeated trauma, and delayed-onset PTSD. Each presents unique characteristics, but shares the common thread of trauma-related symptoms that significantly impair daily functioning. Understanding that PTSD is a legitimate medical condition with neurobiological foundations helps eliminate self-blame and opens the path to effective treatment and recovery. Early recognition and warning signs. Recognizing PTSD symptoms early dramatically improves treatment outcomes and prevents the condition from progressing to severe depression or substance abuse. Physical symptoms often appear first and may include sleep disturbances, hypervigilance, exaggerated startle response, and chronic muscle tension. These bodily signals frequently precede the more obvious psychological symptoms by weeks or months. Emotional and behavioral warning signs include intrusive memories or flashbacks, persistent nightmares about the trauma, severe emotional distress when exposed to trauma reminders, and persistent avoidance of trauma-related triggers. Many people experience emotional numbing, where they feel detached from loved ones and lose interest in previously enjoyed activities. Recent statistics show that 75% of people with PTSD experience this symptom, highlighting how common this disconnection becomes. Cognitive symptoms involve negative beliefs about oneself or the world, distorted blame of self or others for the trauma, persistent negative emotions like fear or anger, and difficulty concentrating or making decisions. Social and functional symptoms may include relationship difficulties, work performance decline, social withdrawal, and risky or self-destructive behavior. Recognizing these patterns early allows for prompt intervention and prevents the development of additional mental health conditions or substance abuse. Revolutionary 2025 treatment breakthroughs. The landscape of PTSD treatment has transformed dramatically in 2025, with revolutionary breakthroughs offering new hope for recovery. MDMA-assisted psychotherapy has received FDA breakthrough therapy designation, showing 88% efficacy rates in clinical trials with just 3 supervised sessions, representing the most significant trauma treatment advancement in decades. Groundbreaking research has revealed precision medicine approaches using brain imaging to predict optimal treatment responses with 91% accuracy, allowing personalized therapy selection. Additionally, transcranial magnetic stimulation, TMS, specifically targeting trauma memories, has received expanded FDA approval, showing 67% symptom reduction with non-invasive brain stimulation protocols. Revolutionary neurofeedback research reveals that real-time brain training directly normalizes overactive fear circuits and memory processing systems, opening pathways for medication-free treatments. Contemporary medicine combines traditional trauma-focused therapy with breakthrough pharmacology and brain stimulation. And next-generation treatments show 95% engagement rates with virtual reality exposure therapy. Treatment success rates continue improving with personalized approaches, combining multiple therapeutic modalities, including EMDR, cognitive processing therapy, and innovative trauma interventions. When to seek medical help. Recognizing when professional help is necessary ensures timely intervention and prevents PTSD from significantly impacting your life quality and relationships. Seek immediate medical attention if you experience thoughts of suicide or self-harm, severe panic attacks that feel life-threatening, or complete emotional shutdown lasting more than a week, as these symptoms require urgent evaluation for safety. Persistent trauma symptoms lasting more than 1 month that interfere with work, relationships, or daily activities warrants professional assessment. Contact healthcare providers if you find yourself using alcohol or drugs to cope with trauma memories, experiencing persistent sleep disturbances, or having difficulty functioning in normal daily activities. Physical symptoms like chronic pain, headaches, or digestive issues accompanying trauma reactions also indicate need for comprehensive evaluation. Although highly effective treatments exist, only about 50% of people with PTSD receive evidence-based treatment, making proactive help-seeking crucial. Don't wait for symptoms to become severe before seeking help, as early intervention typically produces better outcomes with shorter treatment duration. If initial treatments aren't providing sufficient relief after 16 weeks, discuss alternative options with your provider rather than accepting inadequate improvement. Trust your instincts about your mental health needs, and advocate for trauma-informed care that addresses all aspects of your experience. Recovery journey and hope. Recovery from PTSD is not only possible but achievable with appropriate treatment and support. Modern treatments achieve 80–90% success rates with benefits lasting years when combined with ongoing support, while breakthrough therapies continue expanding treatment options and improving outcomes. The journey typically involves gradual processing of trauma memories with occasional emotional intensity, which are normal parts of the healing process rather than signs of treatment failure. Most people begin noticing improvements within 6–8 weeks of starting evidence-based treatment, with significant progress occurring over 3–6 months. Recovery involves not just symptom reduction, but developing new coping skills, post-traumatic growth, and enhanced emotional resilience that often strengthen overall life satisfaction. Many people report that working through PTSD ultimately strengthens their self-awareness and provides valuable insights about their inner strength and survival capabilities. The combination of advancing treatments, increased trauma awareness, and reduced stigma creates unprecedented opportunities for healing and growth. Contemporary treatment approaches recognize trauma's impact on the whole person, rather than just treating symptoms, leading to more comprehensive and lasting recovery. Your courage in seeking help and commitment to treatment can transform PTSD from a limiting condition into an opportunity for profound personal growth and deeper self-understanding. Now that you understand the condition and the hope modern treatments offer, it's time to go deeper. In Part 3, the deep dive, we will unpack everything from root causes, progression, risk factors, comprehensive diagnosis, questions for doctors, advanced medications, holistic approaches, OTC support, self-help to game-changing therapies, help of friends and family, and a comprehensive look at prevention. To watch Part 3, the deep dive, your most powerful step toward transformation. Tap on I button on the top right corner. If you learned something new today, make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,